Now let's discuss the another test of fertility panel, FSH test. What is FSH test? This test measures the level of follicle-stimulating hormone in your blood. FSH is made by your pituitary gland, a small gland located underneath the brain. FSH plays an important role in sexual development and functioning. As we have already seen the previous video where we have told a lot of things similar to the FSH, and the content of LH and the FSH may be similar because both are interrelated. That's why I am something repeating, or some words will be repeated by me. Let's discuss one by one the important role of FSH in women, men as well as in children. In women, FSH helps control the menstrual cycle and stimulates the growth of eggs in the ovaries. FSH level in women change throughout the menstrual cycle, with the highest level happening just before an eggs is released by the ovary. This is known as ovulation. In men, FSH helps control the production of sperm. Normally, FSH levels in men do not change very much. In children, FSH levels are usually low until puberty. When levels begin to rise in girls, it helps signal to the ovaries to make estrogen. In boys, it helps signal the testes to make testosterone. Why we need FSH test, or why it is used for? FSH works closely with another hormone called luteinizing hormone to control sexual functions. So a luteinizing hormone test is often done along with an FSH test. These tests are used in different ways depending on whether you are a woman, man or a child. As we have already discussed in previous video, the LH important role as well as why LH level is used for. But here FSH role in women, these tests are most often used to help find the cause of infertility, find out if there is a problem with ovarian function, find the reason for irregular or stopped menstrual periods. In men, these tests are most often used to help find the cause of infertility as well as find the reason for low sperm count, find out if there is a problem with testicles. In children, these tests are most often used to help diagnose early or delayed puberty. Actually, puberty is considered early if it starts before age 9 in girls and before age 10 in boys. Puberty is considered delay if it has not been started by age 13 in girls and by age 14 in boys. What are the common symptoms of FSH level, low level and high level? Let's discuss one by one this thing. In women, you may need this test if you are a woman, okay? You have been unable to get pregnant after 12 months of trying, your menstrual cycle is irregular, your periods have stopped. So this test may be used to find out if you have gone through menopause or are in perimenopause. And if you are a man, you may need this test if you have been unable to get your partner pregnant after 12 months of trying. Your sex drive is decreased. Both man and woman may need testing if they have symptoms of pituitary disorder. These include some of the symptoms we have already discussed in previous video: fatigue, weakness, weight loss, decreased appetite, etc. Your child may also need an FSH test if he or she doesn't seem to be starting puberty at the right age. We have mentioned the right age for girls as well as for boys. As we have already discussed the LH level and the content of LH level, full case study of LH level, and the LH level is similar to the FSH because FSH and LH tests are correlated, interrelated. So your doctor will suggest both tests. So this information can be similar to the LH test because both tests are the same. But I wanted to be sure that this FSH test is something different at some point, not in every point. In some point it is different, but it's not wholly different. Without both these tests, both means FSH and LH, your doctor cannot check your exact result. So let's discuss the FSH result mean. If you are a woman, high FSH level may mean you have primary ovarian insufficiency, also known as premature ovarian failure, is the loss of ovarian function before the age of 40. PCOS, a common hormonal disorder affecting childbearing women, it is one of the leading cause of female infertility. Started menopause or are in perimenopause. An ovarian tumor, Turner syndrome, a genetic disorder that affects sexual development in females. It often causes infertility. If you are a woman, the low FSH level may mean your ovaries are not making enough eggs. Your pituitary gland is not working correctly. You have a problem with your hypothalamus, a part of the brain that controls the pituitary gland and the other important body functions. You are very underweight. These are the signs. Now, what do the FSH result mean for the men? If you are a man, the high FSH level may mean your testicles have been damaged due to the chemotherapy, radiation, or alcohol abuse. You have some kind of syndrome, a genetic disorder affects that sexual development in males. It often causes infertility. If you are a man, the low FSH level may mean you have a disorder of the pituitary gland or hypothalamus. In children, high FSH level along with the high levels of luteinizing hormone may mean puberty is about to start or has already started. If this is happening before age 9 in girls or before age 10 in boys, it may be a sign of something that we have discussed in previous video of LH. You can go through that video. A disorder of central nervous system as well as a brain injury for the children. Let's discuss the important part of this presentation, the treatment for the high FSH level as well as low level of FSH. But every one of you need to consult your doctor first. If you are gonna treat yourself at home or on home remedies, okay, don't take any kind of remedy. First consult your doctor, ask your doctor about the best ever treatment for your low level of FSH or LH. So here are some tips. So you don't need to follow. If you are outside from India, if you are in India, something method of treatment can be changed for every one of you. Using donor eggs for IVF is an extremely effective treatment for the patient with high FSH levels, and it is much more common that you think. Babies conceived with donor eggs have brought untold joy to so many families. who would otherwise never have been able to get pregnant. So this is a very good thing for every one of you. Injection of FSH ovarian stimulating drug is used for increased level of FSH in female. Treatment is started early the menstrual cycle. It is usually used in the sense of stimulation of the development of ovarian follicles. It is important to check regularly to prevent excessive hormone replacement. You can also apply this method, but consult your doctor first. Important things also included here: fertility drugs contain FSH and LH to artificially alter means change the menstrual cycle and increase the chance of pregnancy. The FSH stimulates eggs to mature in the ovary, and the LH encourage ovulation to occur. Thank you very much for watching the video.